I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this edition of IDD Health Matters. We have a really special guest, Steve Gonyea from New York. Welcome, Steve.
Good morning, Doctor.
So Steve, I know that you have a son with an intellectual disability, and you're also an advocate, and you've been in advocacy for quite a while. So tell us your story.
Sure. I had 3 children at the time. My third child we were seeing symptoms of disabilities and undiagnosed things. We bring them to his pediatrician. They didn't really know what was going on. Years later, we found out it was autism. Back then, they didn't really know what that was. So I can understand from the doctor's viewpoint, they weren't sure where to go with him. He was having behaviors. He was having some mental health stuff, all kinds of things that we just didn't see in my other 2 daughters. And we finally, as time went by, years later, he was diagnosed with autism, diagnosed with a chiari malformation, diagnosed with a central auditory processing disorder, and we were able to get him some help through the medical part of it, through his pediatricians, some of that part. And then what happened was I went to an agency. I went to a couple of big agencies, wound up on waiting lists, wound up with a small agency. He was able to get services much faster that way, and more importantly, probably when we needed a phone call, an answer, we were able to call them and get that. So that piece was important going through, and then it was trial and error. He had difficulties in school, he had difficulties in public, and he had difficulties in home. And we had to kind of solve all of that. And my advocacy for others started when I tried to help others that saw some of the things that we were working through with my son. They were seeing also, and they drop them off, and these kids would stay for a day or two. And
so they would stay where, like at your house?
They'd stay at my house.
Okay.
One summer, one of the kids, I remember that little child couldn't go anywhere else in the neighborhood because he was so, they thought it was ADHD, but he wound up being autistic too. And he was all over the place. So he couldn't go to other people's houses. The parents, after the first visit, they wouldn't bring him back. I remember that one summer, he spent almost the whole summer with us. And so we got a chance to, be with him and see some of the symptoms with him, and then see some of the things that helped me with my son. I could help with that child too. Mm-hmm. That child wound up really improving. To this day, he is friends with my family. His parents came to my wedding because there was such a remarkable difference in this child. And back then, they didn't have any support either, like I didn't when I started with my son. And then what would happen is they would tell people, and other people would tell people, and the agency I was with was saying, boy, this guy's got some success. He's getting pretty decent at this, and knowing where to go and all of that. More and more people started calling me, and then it wound up being like a community thing. And that agency actually put me on their board, and I picked up that piece of advocacy from being a board member. I was able to advocate some things for being a parent on that board that helped, and that progressed into a whole bunch of other things, some other titles. I'm currently a New York State statewide co-lead for NIAD, which is the Disability Association.
Nice.
And I'm a Department of Health ombudsman on the mental health part and aging part of it. One of the things I'm looking at, I'll talk to you in a bit about, is doing something with an ombudsman program for children, because they don't have that right now. So
what started as just you trying to understand the system to find supports and services for your son has really kind of evolved into you really doing this on a much bigger level and helping a lot of people out now.
Yeah. Look, I always had jobs and all that kind of stuff, and I worked around it. Probably for the last 15 years, I've done this solely. Wow. All volunteer stuff. I get involved with a lot of different agencies in my area, and I'm very geared towards solutions for some of this stuff. What's interesting is when you do this for a long time, you listen to other parents who've gone through this, and a lot of them are saying some of the same things as far as roadblocks in their way. 30 years ago, they were going through the same thing. They're still going through the same roadblocks and doing the same kind of advocacy, going down to Albany and with the signs and the groups and all that kind of stuff and hoping for drastic changes. And when it doesn't change, then you get parents' discouragement.
Sure.
In apathy and all that. And then they don't want to get involved.
So, Steve, what in kind of the big picture, what are some of the big picture roadblocks that you saw on a repeated basis?
What I failed to mention is we were a therapeutic foster home. We got into that. We started doing state adults, adults with mental health issues. We had one that was blind, all disabled that were in group homes and things like that they were trying to get them into a lower level of care. So they developed this family care program, and we were in that for a while.
Okay.
And my wife and I decided we wanted to do children. It would just be easier. We had some really difficult. We had an Alzheimer's patient in our home. We had a blind patient, and they both wound up being successful. But it was a lot of work. It was 27, and so we decided to get out of that and went into therapeutic foster care. Got certified. And 178 children have come through our home in the last 15 plus years.
Wow.
Through that. And most of those kids have trauma-based issues going on. They've got mental health issues going on. And what I found is that almost all the ones that we get in the therapeutic house, because there's a difference between a therapeutic foster parent and a regular foster parent, is that most of them have multiple disabilities and dual diagnosed things going on, a lot of autism. And I never really put two and two together, but I did some research and I found out that 1 in 4 children right now are on psychotropic drugs in foster care, which is 4 times, I guess, the national average.
Wow.
Children being on drugs. And I think what happens is, because they're bounced around the trauma and the kids don't know where they're supposed to be and they don't have a sense of belonging, they act out and they try to medicate that behavior, and it doesn't work. One of the children that was here, he was in a state facility in Pennsylvania. His grandparents were here. They brought him back. They tried to get him into New York State. They couldn't get him back in here because of diagnoses that were attached to him, and they couldn't get him through facilities around here. They tried, I think it was 23 facilities to get him back in here and into New York so he could be with his grandmother, Pennsylvania. And everybody turned him down because of those diagnoses. So they wound up trying to come through foster care at the time. And again, difficult situation, complex issues with him, including schizophrenia was one of his diagnoses, which is why I think a lot of the places turned him down. But anyways, they asked me if I would take him, and my wife and I don't say no. So we got taken him, and he came in with 28 meds into our home, and we couldn't understand why. I mean, they came in bags and bags and bags of meds.
Wow.
We couldn't understand all of that. So I started doing research. I checked with the facility he was in for a long time. He'd been in and out of previous foster care, multiple facilities, and so we didn't know what to do. So we wound up looking into it, and I checked. I bring him to it because once he gets assigned to foster care, he gets assigned a pediatrician and a psychologist. And I asked the psychologist. He says, "Look, can anybody tell me why he's on all these meds?" And they went back and checked, and they couldn't find out. And it's one of my big pet peeves in the foster care system is there's no oversight, nobody's checking from the time they come into care on a med until the time they leave. It could be years later. We've had kids 9 years in foster care on and off out of my home. And we don't like all the meds. My son was on a bunch going through all that. He's on 2 now. There's times it's needed. But what we see is a lot of times it's not.
Yeah. That's something we call polypharmacy. People get put on lots of meds. Sometimes they might be appropriate and they might be needed, but sometimes maybe we're trying to treat behavior, an adverse behavior, but there really might be some other underlying cause, but they get put on this medicine, and then maybe it works or maybe it doesn't, so they add another one, and people end up over time being on many, many, many medicines. And like you said, sometimes nobody really knows why they're on all of these medicines. So what ended up happening with him?
So normally when you want to start, because I asked to start decreasing some of this when we went down the paper trails and we couldn't find a reason why he was getting meds for seizures and meds for schizophrenia. I went to the doctors. I said, you got to help me here. I want to start decreasing the meds. And the problem with that is they normally want to take the child and put him on the campus, which we have. The agency has a campus where they can have a staff, round-the-clock staff, do it for 30 days. And we've done that before and gotten little results, to be honest with you, about what we were looking for with it. And so I asked the doctor, and I think I was one of the people they ever allowed it. They allowed me to start discontinuing this child's meds in my home, and because I was always around, my wife said, and I could keep an eye on stuff. That child is now on 3 meds. The 5 seizure meds he's on was on. There was no paperwork for a seizure. We went down multiple roads while he was in my home, and they couldn't find anything why he was on those 5 seizures. We wound up getting him a clinical visit out in Rochester, and they said he didn't have schizophrenia. So here this poor child's walking around with a schizophrenia diagnosis and nowhere to go. Nobody's going to take him if we don't hang on this kid because of that diagnosis, and come to find out he didn't have it.
So he's down to 3 medicines now. And how's he doing?
You know what happened? The drooling and all that kind of stuff when he came into my home on my couch, and the normal behaviors and stuff like that decreased. You would think it would be just the opposite,
right?
That because of all these, he's not on all these meds. Let's you're probably going to have issues, Steve, and we didn't. And I've used that case to decrease other children in my home, and it's worked. There's children in my home, right? We have 4 foster kids in our home right now. In December we had 8. Most of them on meds, most of them on the same meds, which is another telling story. And I think, like you mentioned, I think sometimes, unfortunately, people don't know what to do. A foster parent's, pulling her hair out, don't know what to do with the child because he's acting out. They want meds. They bring him down. I need help. I want meds. And what we found is that's not the answer. The answer is usually the environment. It's usually some other factors going on. It's usually the fact that the kid was traumatized and he has no sense of belonging now because he's been 12, 15, 20 foster homes. And I wonder why now.
Yep, Steve, that's why I wanted you on the show to tell that story. That's something I talk about all of the time, but you bring, a real human touch to it. You have that lived experience that we always talk about. You've seen it happen, you understand it, and you see that people so many times can do better with much less medicines that they're on. When we look at other potential causes. Yeah. That's excellent. So tell me more about some of the advocacy work that you do.
Yeah. Again, like I mentioned earlier, I'm not a fan of doing the same old thing. I don't want to be those other parents that are out there that I hear all the time from, the ones that have gone through Willowbrook in New York and some of those situations. I don't want to be 30 years, 10, 15, 20 years or whatever, that doing the same old thing and expecting a different result. I think they call that insanity.
Right.
Don't do that way. And I will go down there to participate in some of those things. I've gotten more into the tabling things and getting our message out. Some of the groups I'm in, and not so much to the other. I think what happens is with all due respect to everybody down there, I think it becomes a photo op. And we can't get anything done. So before and after those kinds of things I do, I contact my assembly people, I contact my senators, and I try to get a one-on-one. And I'm in a lot of groups, and they meet with some of these state commissioners, and they meet with some of these legislators and politicians, but in a group setting. The problem with that is if you've got 10, 15 people in there and they've got multiple staff of their own in there, you're not getting a lot done. You're not getting solutions. You're basically telling them something that they've already heard, and from a lot of different sources and a lot of different advocates going down there for not just foster care or not just for the IDD community. And when I find that I can get in one-on-one, I'm able to make a lot more progress with it and make things happen. I call it planting seeds.
Sure.
And even though I might not get I'll meet with one of the legislators one-on-one, I might not get anything right there, but I planted a seed, and I'm very active. And going back to the solution, I think a lot of what I do is based on credibility. When my son had nowhere to go because of his disabilities and autism, and he got tired of walking around the mall, I decided to build something here for him on my property, and it was supposed to be a 10 by 12 shed. That's what I told my wife. Wound up being a 2-story barn with everything you can possibly imagine in there. And we started letting kids in the community with disabilities use it because it was so fantastic. It had all kinds of sensory things in there, a lot of music, guitars, drums, old-fashioned 8-tracks and record players, and really cool things. Yeah. We have an Xbox in there. It's interesting. Nobody uses it. Because of all this other cool stuff in there and sensory stuff, these kids come in and they use everything but that. And anyways, it got out there in the community. People started using it, and we don't charge for it. We let them use it. And somebody decided to, tip off one of the state news things, and they came and did a story, which I'm not really, I wasn't really planning on doing that. I'm not really looking for the glory type stuff with that. But what it did do was I started getting calls from all over the state, from parents, from agencies, and looking to do something like that in their area because they didn't have anything like that. It was so unique. And but what it did was, when you do something like that and you're talking to a politician or you're talking to a legislator or a community leader, and they know you've already come up with solutions for something, it gives you a lot of credibility.
Sure.
And it's the same thing. I got on the board of this small agency. I wound up getting on multiple boards. And then when I got on those boards, I'm able to make things happen because I'm on their board. And I'm pretty vocal about it because I go back to, I've lived this. I know what needs to be done. So a lot of our children that comes through here or through foster care, we take Raise the Age kids, which is the juvenile court kids, usually 13 and up, and those kids, and respite kids and stuff like that. We find out all the time issues with that that they run into, and there's roadblocks. And when I'm on the boards and stuff like that, and I'm coming up with solutions, that gives a lot of credibility to all of this. And
so I love the barn idea. It sounds like it's been very successful and well received for sure. Are there some other, you mentioned solutions, are there some other things that you've worked on that you think have been particularly, exciting or interesting?
Yeah, look, and we had to, again, learn the hard way. And unfortunately, it was through some children here that were on waiting lists. We had 2 children here that were on waiting lists because when a child in our area has to have dental done and they go to the only provider in town that will take Medicaid because the reimbursement rates are so bad, then what will happen is they get referred out. If they can't sit in the chair, they're referred out. If they don't cover their insurance, they're referred out. Most of the children that I get in the therapeutic end, in fact, many in foster care, are hard to do dental and hard to do pediatric work on them. And so one of the, I would call it a successes, is making sure something happens. And 2 of my children that were young, they were like 5 years old, developed abscesses in their mouth. And now the problem with that is it still doesn't fix the problem that we can't get anything work done locally. But what it did do, push them to the top of the line. And instead of waiting again, we took them, we had them sent I went to the ER and had them sent by ambulance. Now, the problem is with that, it's a lot more costly and stuff like that. But that's one of the solutions I can bring to the state and say, look, we've got to do something with these waiting lists, because these two kids, one of them had an abscess so bad he was in the hospital for 13 days.
Wow.
And so it's telling that we have to find solutions to that. So again, I'm continuing to work on the dental piece and the pediatric piece. I joined several big agents, advocacy agencies, trying to find some ways. I got a hold of somebody that is the president-elect of one of the incoming president-elects for the dental board part of this. And I've actually been working with her, and she's looking at providing training and things like that with our IDD community before they even step foot in the dentist's office of their own. And then I can work with, then I can go to the politicians and I can say, look, we're already working on some of the solutions for you. Can you maybe help with some of these student loans that they're doing for going into dental, especially if they're keying on the IDD community? So those are things that we're working on right now, rather than just say it's an issue, because everybody's saying it, doctor. So many parents who call me are saying this stuff. But the answer is just not to keep saying it, because nothing's going to happen. We have to find a way to make this happen and do out of the box stuff, because the things that I've been able to get done, and the way things I've been able to get done, has usually been something creative, something out of the box. It's so far out of the box, and then I have to sell it to them. But once I get them sold on it, and then it happens, it's a lot easier with the credibility part to go to a politician and get them to sign on a bill, or sign on, things coming through.
Sure. I love that approach. I mean, like you said, you definitely have the experience. People are going to listen to someone who's been through it once or twice or 150 times, dealing with complex problems, and you work with people to make change. And that's very valuable and very, very important. And of course, it helps, people that you are providing support for directly, but it also helps everyone when you advocate on those levels. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Something I like to do in the show is we call it 3 in 3. It's 3 things in 3 minutes, and I'm not going to hold you to 3 minutes. But do you have like your top 3 things that you think listeners would benefit from hearing, that maybe you think can help improve supports and services for people with intellectual and developmental disabilities?
Yeah, look, I think the solutions to some of this is very complex.
No doubt. Agreed.
Because of the monies involved and all that kind of stuff, the reimbursements and all of that. It's complex. But I do think there's an ability to fix a lot of this stuff, again, out of the box. The first thing I would do is, I mentioned earlier about the ombudsman program that the Department of Health has. And I know that my local assembly person is now working on an ombudsman bill for IDD community in New York State. And I believe it's been passed by the state and the assembly, and we're trying to get the governor to sign off on it. And the reason to do that is to have some oversight in some of the things I was talking to you about, like the over-medication of these children. Somebody can be looking at that stuff. Mm-hmm. Somebody can be looking at why there's 2-year, 3-year, and 4-year waiting lists for some of our kids. When we get a kid in foster care that needs it, almost all of them need a developmental evaluation, we need to be able to go in and get that done, because it affects the school. We had a 7-year-old in our home that had never been in school. He's almost 8, actually, had never been in school. And where do you put him? What grade do you put him in? And you need a developmental eval to find out where he's supposed to be, because he was nonverbal. Well, when you got an 18 to 24 month wait
time, yeah, wow,
it's not acceptable, because it's what do you do with the child? And so, look, I would suggest that the parents try and get creative. What I did in that particular case is, because I still had to wait, I certainly could push the agency who was doing the evals to try and move them up because of the circumstances. And we were able to do some of that. But also I went to my school district and I got them to offer this kid speech, PT and OT before he'd even set foot in the classroom. He actually had not even been put in our school yet because that's how I got it right away. I got my CSE chair to okay that. It's kind of unheard of, but they did it. And we brought this kid down who'd never been in a school, never set foot in a classroom, who was all over the place. We got him doing some of these specials, so to speak, before he even went into whatever grade he wound up going into. And if we can get parents to do that kind of advocacy.
What a great advocacy success story there. So that's kind of your number one thing, is having parents advocate for out of the box solutions, maybe.
Yes.
Sometimes.
Look, we can't. I have been doing this a long time. We can't ask our state agencies to do all of this stuff. We can't ask our politicians to do all of it. I think a lot of it we have to, as bio parents, or in my case, bio and foster parent, we have to try and find a way to come up with some solutions. And they're not always easy, and sometimes it's hard to do some of this stuff. But the answer is not to do anything. And this poor child, the 7-year-old, that I don't know what would have happened if we hadn't, because he had never set foot. He was an eloper, and it fixed the issue. Now this kid is that's in school right now.
Great. So what's kind of your number two thought?
I would say I think it goes back to what I was saying earlier about reaching out to the medical part of this. Mm-hmm. Again, not asking the state to do all this stuff because they're not going to. They're not going to give you the money for a lot of this stuff. So we have to find another way. And like I mentioned, I think parents, if they can find a way to get a hold of the doctors and dentists in their area and see if there's a way they can help. I think that if their doctor would take a couple of IDD patients, I know the reimbursement rates are terrible, but talk to them. We've had some good luck with some dentists. I actually was just talking to another parent. We've got a local dentist who's willing to do some work with the IDD because we went out and got him and asked him. We're not asking him because he's got a practice and he's busy. But if we can take a couple of our children out there in the community, it will help. And
Steve, that's a good point, because a lot of times if there's a clinician out there that gets known to be, a person who takes care of people with intellectual or developmental disabilities, they end up getting overwhelmed with everyone in their area, which can be quite of a challenge. So I like that approach. It's like, hey, could you at least see just a handful of our patients? I like that.
Probably the third, look, all my things are both basically out of the box and solution based things. I want to get things done. Again, I think it's important that if you've got an IDD child or family member, that it's as exhausting as it can be. You've got to try and do something, and reach out to there's family support groups out there. I'm a member of multiple family advisory groups. The reason to join them is not so much that I know can be time consuming and things like that. A lot of them are virtual now. You can still be in your home with your child, your family member, but I would suggest doing that because you're going to hear some of these stories on a local level that you're not going to hear out in the community, very often. And like-minded parents who are going down the same roads as you. And what happens is you share information, you share possibilities. I know some families that actually, because they couldn't get respite, are actually now trying to share respite on every other weekend with the other ones, and they alternate so that somebody gets a break. I know that we're looking at a lot of different avenues for housing and things like that. There's, I've got parents with IDD individuals, they can't find housing, they're aged, they're up there in age, and they're trying to figure out what they're going to do with their children. There's creative things. If you join some of these groups, you're going to find out that there's a bunch of us out there that are trying to come up with creative things. I know parents that'll pitch in with 3 other parents and buy a house and have 4 boys in the house, and then we can go. And then what happens is you've come up with a solution that you can go to your self-direction budget through Life Plan and through the state agency, and try and get that staffing for the third shift that you might need, because they probably would be in a day program during the day. So there is creative things to do. I would urge parents to continue to go down those search.
And that's a great third thing is people in similar situations just getting to know each other, and you can learn learn something that maybe somebody else has been through that they found a solution for that you might be able to implement, or like you said, partner together and be of support to each other. That's a great thing. Steve, I love the positive approach that you take and the out of the box thinking that you take. It's clear that you have positively impacted the lives of many, many children and many, many parents as well too. I really thank you for taking the time to talk with us today and to share your story. It's really great to know you, and I love the work that you're doing, and keep it up.
And I also appreciate you put me on your show. I think it's important that these messages get out there, and it provides hope for a lot of families out there, and a lot of people that were in this IT community. That there's a lot of us out there trying.
Yeah, I love it. Love your attitude. If people wanted to contact you or learn or get some information, do you have a way that they can contact you that you're comfortable sharing?
Yeah, I'm on Facebook. You can. My name is on Facebook.
So Steve, Gonyea.
If I can give my email address, I'm okay with giving that.
You certainly can if you'd like to.
Steve_Gonyea, Gonyea at yahoo.com. And feel free, because I will answer, and especially if it's parents, because that's what I do all the time. My phone ringing earlier was some of those parents.
Well, again, Steve, thank you so much for taking the time to talk with me today and for the incredible work that you're doing.
Thank you, Doctor. Have a great day.
You too.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.